Today's topic is Norma Basalis. Okay, question will be coming from this part in the osteology viva and in the spotter. For example, in the spotter, this specimen will be given with a probe, okay, a rod probe, okay, sticking through this foramen, okay, and near to that the question will be written: what is the name of this foramen, what are the structure passing through this foramen, okay. So these are the things for the spotter, okay. There are lots of foramens, lots of holes, okay. This will be a long class, this will be a boring class, and this is a class जिसका content is your duty to mug up, okay. I will just show you the things, I will just show you the contents, okay. I will tell you about the contents. Now in the viva also, if this specimen is given, they will be asking you question: name of these different parts of the skull, different bones, different name of these foramens, the structure passing through this foramen, okay. So it is important class, okay. So today's topic, Norma Basalis. If you are having the skull specimen with you, you will see. Otherwise, I will be asking you to come forward after I teach each and every part, okay. There are 3 parts. I will be asking you to come forward for 3 times, okay. If you want to see, you can come forward. Otherwise, it's up to you, okay. Now, this is the Norma Basalis, okay. There are Norma verticalis, lateralis, frontalis, occipitalis, okay. Our topic for today is Norma Basalis, okay. Kind of the hardest part of skull, okay. So, from inferior aspect, we see this skull bone, okay, this whole thing. Now, to make it easy for us to learn, we divide the inferior aspect of skull in 3 parts, okay. What are those 3 parts? These 3 parts is divided by these 2 lines, okay. These are not necessary, I will ask you to write, okay, only if you want to write, okay. There is no obligation to write anything in my class, okay. See, the upper one, this one, okay, this one and this one, this thing is the heart palate, okay, this one here, okay. This is the posterior free margin of heart palate, okay. So one line, these are transverse imaginary line passing through this posterior free margin of heart palate, one. Another one, this is called foramen magnum, okay. Another transverse imaginary line passing in front of this foramen magnum through here, okay. Dividing the inferior aspect of skull in 3 parts, one anterior to that, one in between of those 2 imaginary line, and one behind that, okay. These are the 3 parts. Now, what are the bones that you see on the inferior aspect? The green one that you are seeing, okay, this is the maxilla. This is the maxilla bone, okay. This is maxilla, okay, the green one, okay. The whole thing is heart palate, but its anterior 2/3 is made up of maxilla, okay. Now, the posterior 1/3, the pinkish reddish one, okay, जो भी है, that is the palatine bone, okay. This is horizontal. If you hold the skull in anatomical position, this is horizontal. So this is the horizontal plate of palatine bone. There is this perpendicular plate also. If individual bone will be taught, then it will be shown, okay. But for now, just know this is the horizontal plate of palatine bone, okay. 2 bones. Now this yellow one, this is the sphenoid bone, okay. This thing, I don't know, I'm sure, I don't know, I'm sure you will not see from that far. This part, these are the sphenoid bone. Okay, these things. Okay, this whole yellow one. Okay, the piche wala part, the posterior aspect, we see the occipital bone. Okay, this whole thing. Okay, and this is the temporal bone. Temporal. Okay, this part, this whole thing is the temporal bone. Okay, these are the bones that we see. Now we will talk about the boundary for Norma Basalis. Okay, from here, it starts from here. Okay, what is this? This is alveolar arch. Alveolar means anything related to the teeth. Okay, for alveolar arch, that is made up of maxilla, maxillary bone. Okay, this is the maxilla forming this arch. Okay, alveolar arch, it holds the sockets for the upper teeth. Okay, from here, then this one, zygomatic arch. Okay, then this one, these two. Okay, mustard process of temporal bone. Okay, piche, this one, in the occipital bone there is this occipital protuberance. Okay, a protruded part from the occipital bone called occipital protuberance. So this is the boundary of our Norma Basalis. Okay, this is the boundary. Now we will be learning about the easiest part and the first part, that is the anterior part. Now, as I have told you, the anterior part is the part that is lying in front of the imaginary transverse line, that is drawn on the posterior free margin of this heart palate. Okay, इसके सामने जो है. Okay, this anterior part is made up of two bones, maxilla. Okay, forming the alveolar arch. Okay, and the whole of the heart palate. Okay, this whole thing. Now the anterior, again, the anterior 2/3 of this heart palate is made up of maxilla. The posterior 1/3 is by the horizontal plate of palatine bone. Okay, these are the bones. Now these are separate bones. Okay, maxillary bone, one from the left, one from the right, joining in between, forming this intermaxillary fissure. Okay, where two bones join, they form a fissure. Okay, intermaxillary fissure. Same wise, there is this interpalatine bone. Okay, one left and one right palatine bone joining in the middle, interpalatine fissure. Okay, and these are two separate bones, right? Anterior 2/3 maxillary, posterior 2/3 palatine. So this is palato-maxillary fissure here. Okay, सामने से you will see, I will show, don't worry. Okay, now our main interest from this part will be those foramens. Okay, there are three foramens that we need to see. If you know, these are the incisive teeth. Okay, ठीक इसके पीछे in the heart palate there is this foramen. Okay, this one, this is called the incisive foramen. Okay, now your task will be to write this both. Okay, दोनों चीजें लिख लो. I'll tell you about these things. Okay, incisive foramen and greater palatine foramen. Write this down पहले. If you can see, this is the nasal cavity. Okay, this is the oral cavity. Okay, this is the oral cavity, of course. So this incisive foramen is a connection between this nasal cavity here and the oral cavity here. Okay, so there is this another foramen, greater palatine foramen. So as the name suggests, it will be on the palatine bone. Okay, on the horizontal plate of palatine bone. Where is the palatine bone? The posterior 1/3 of the heart palate. Okay, इसमें this big one that you can see here. Okay, if you can see, otherwise I will be asking you to come forward, then you can see. Here is the greater palatine foramen. Okay, now greater palatine vessels from this greater palatine foramen will come out. Okay, and it will traverse in front and will go into the incisive foramen. Okay, to reach the nasal cavity here. Okay, and the nasopalatine nerve from the nose will traverse through this incisive foramen and go behind. Okay. Now this is about the greater palatine foramen. These are the structure that transmits through these greater palatine nerve and vessels. Okay. Now there is this another foramen behind the greater palatine foramen. Okay. Anterior, posterior. So posteriorly to the greater palatine foramen, there is this foramen. These are called lesser palatine foramen. Okay. Not of much importance, but जान लो अगर पूछ ले what is this foramen. Okay, lesser palatine foramen. These are 2 to 3 number in this ceramic specimen. There are 2 on each side. Okay, these are lesser palatine foramen. And one last thing, there is this left and right horizontal plate of palatine bone. They join in the middle. Okay, this one. This is called posterior nasal spine. This thing. Okay, this one is the posterior nasal spine. Okay, it gives attachment to a muscle of soft palate, musculus uvuli. Okay, and this was about the first part. Okay, the anterior part of Norma Basalis, and it was the easiest part. Now I'll be asking you guys to come forward in a group of 10. Roll number 101 to 110. So the boundary, zygomatic arch. Okay, mastoid process, occipital protuberance in the occiput. Okay, this is the alveolar arch. Okay, this whole thing is the boundary of Norma Basalis. Now for us in the anterior part, okay, 2 transverse imaginary line, 1 through this posterior free margin of hard palate. Okay, anterior margin of foramen magnum. Okay, so we'll be talking about this part. Okay, what is no the anterior part only. Okay, so इधर तक क्या क्या है. Okay, इसमें क्या क्या दिखता है. Okay, there are 2 bones only. This is the maxilla. Okay, this maxilla bone forming this alveolar arch. Okay, holding the sockets for the upper teeth. Okay, this is the alveolar arch. Now this whole thing is the hard palate. The anterior 2/3 is by maxilla. Okay, and the posterior 1/3 is by the horizontal plate of palatine bone. This is the as you all know, the middle part between these 2 imaginary lines. Okay, this part is the middle part. Okay, toughest one. It is the toughest one. Kindly try to pay attention. Okay, in the middle part, this one. Okay, यहाँ से यहाँ तक. Now we will divide this middle part into median area, lateral area. Okay, lateral area and median area. Now we will see what are the things we see in the median area. What are the bones that we see in the median area? This one is the vomer, and bone called vomer. This one. Okay, this part is the vomer. Now this whole yellow thing is the sphenoid bone. Okay, in the midline we see these 2, this one and this one. यहाँ पे ये जो दिख रहा है, this one and this one. One is medial pterygoid plate, one is lateral pterygoid plate. This is a part of sphenoid bone only. Okay, it is originating from pterygoid process. Okay, what is pterygoid process? There is a, if it is shown to you individually, you will know there is this thing. This is called greater wing of sphenoid. What is the greater wing of sphenoid? This part is the greater wing of sphenoid. Okay, this one is the greater wing of sphenoid. There is this body of sphenoid here, where the body and the greater wing of sphenoid joins. There is this pterygoid process, and from the pterygoid process, the medial and lateral pterygoid plate originate. Okay, this is about the thing. Then we see in the middle area the body of sphenoid, and this is occipital bone. Okay, and this part of the occipital bone is called basi-occiput. Okay, these are the bones, basi-occiput. Okay, this part, kind of this part. Okay, this part, basi-occiput. Okay, now In this basic occiput, you will see this one, this thing. Okay, that is called pharyngeal tubercle. Okay, I will ask you to come forward, then you will see. This is called pharyngeal tubercle. Here, the superior constrictor muscles of pharynx attach. Okay, pharyngeal tubercle. Okay, now these two, I am omitting some things. Okay, you don't need to go in such details. This is about the median area. On the lateral aspect, what do we see? We see this greater wing of sphenoid on both the sides. These are the greater wing of sphenoid. Then we see this temporal bone. Okay, this whole thing is the temporal bone. Okay, this whole thing is the temporal bone. Temporal bone is having three parts. Okay, one is this part, petrous part of temporal bone. This one. सामने से I'll show you. Don't worry. This is the squamous part of temporal bone, जहाँ पे temporomandibular joint forms, and there is this tympanic part of temporal bone. Tympanic means something related to your hearing. Okay, so there is this external auditory tube or canal for your hearing. कान का छेद. Okay, tympanic part. Okay, these are the parts that we see on the lateral aspect in the middle part. Now, this one, Pterygoid Canal. Pterygoid Canal, as the name suggests, it will be something related to the pterygoid plate. Okay, it is related to the medial pterygoid plate, not the lateral one, the medial one. Okay, this is the superior aspect, right? Superior, this is inferior. On its superior aspect, there is this pterygoid tubercle. Beneath this lies the pterygoid canal. Okay, you cannot see, of course, इतना आसानी से तो नहीं दिखेगा. It lies beneath this pterygoid tubercle is the pterygoid canal. Okay, now write down this thing. This is a question to be asked in the exam. What are the things that are passing through this pterygoid canal? Vidian snap to pterygoid canal and vessel of pterygoid canal. Okay, just write about this pterygoid canal. You don't need to know about this scaphoid fossa. Scaphoid fossa is something that lies between these two pterygoid plates. इसके बीच में होता है scaphoid fossa. Okay, now this one is very important. Okay, this is the temporal bone. Okay, this is the lateral aspect. This is the inferior aspect, right? So it is called infratemporal. Okay, so this is the infratemporal surface of greater wing of sphenoid. This one and this one. Okay, now I will show you this greater wing of sphenoid. This whole thing. We will talk about this yellow thing. Okay, now it is having four margins. This is the anterior margin. This is anterolateral, posterolateral, posteromedial. Okay, now for our interest, this is the most important one, the posteromedial. Why? Because as you see, there are some foramens. Okay, and these are very important. This will be surely asked in your spotter and in your viva. Okay, now we'll talk about these foramens. Okay, so this is the greater wing of sphenoid. This is the this is the anterior margin, anterolateral margin, posterolateral margin, posteromedial margin, and in the posteromedial margin you can see these foramens, right? These are present in the posterolateral margin. Okay, now in the posteromedial margin, the first one, the most obvious one, and that is oval in shape. Okay, it is kind of oval in shape. It is called Foramen Ovale. Okay, and the structure passing through this, we at the end I will be talking about this slide. Okay, this one. Okay, then you can see Foramen Ovale से क्या किया जाता है, this and that. Okay, it will be easier for you at the last. Okay, but for now just write it down. What are the things passing through Foramen Ovale? Okay, these are the male structures. This is a mnemonic, male structure pass through this Foramen Ovale. Okay, What are those structures? MALE. Mandibular, accessory mandibular, lesser petrosal and emissary. And these are tough things, okay? You need to mark this up. इनमें से ये क्यों जाता है? I don't have any explanation, and I'm sure HOD sir also cannot tell you, but these are the things that you need to mark up. Where the posterolateral and posteromedial margin join, there is a spine that is called spine of sphenoid. It is a spine-like projection. Okay. सामने से I will show you. Don't worry, but I will show you this image. यहाँ पे this yellow part is the spine of sphenoid. Okay. So this is the foramen ovale. इसके ठीक पीछे there is this foramen, and इसका boundary is somewhere this one. This spine of sphenoid. So this one is called foramen spinosum. Okay, because its boundary is having the spine of sphenoid. Okay. So ovale के पीछे, if you are seeing a hole, that is the foramen spinosum. Okay. This one. Okay. Ovale के पीछे, that is foramen spinosum. And you need to know what are the structure passed through this triple M structure. These three, write it down. Triple M is your mnemonic if you want to write it like that. Now, if you remember, this is which bone? What is this bone? Maxilla. What is this? This one. Medial and lateral pterygoid plate. Okay. Between these two, there is a fissure. Okay. Pterygoid and maxilla के बीच में there is a fissure. That is called pterygomaxillary fissure. Okay. Pterygomaxillary fissure. इसके posterior wall में, if you can see, इसके posterior wall में there is this foramen. जो सामने से it will be hard for you to see, but अंदर से this is the foramen ovale. Okay, this one is foramen ovale. इसके सामने एक open होता है, that is foramen rotundum. Foramen ovale के ठीक सामने there is this thing called foramen rotundum. Don't worry if you are not seeing anything or not understanding anything. These things will be alien to you, but yeah, after one or two reading, you will be familiarized. Okay. So this is foramen ovale. इसके आगे एक होता है, that is this one called foramen rotundum. Okay. देखते पेची दारा देखाচ্ছি. Write it down by the way. That is the foramen rotundum. देखा जाए? ये देख, maxillary process, pterygoid plate, pterygomaxillary fissure. ঠিক আছে? এটা foramen rotundum. ঠিক আছে? ওভেলের সামনে একটাই আছে। দেখতে পাচ্ছিস সেটা? এটা যদি এদিক দিয়ে প্রোব ঢোকাস, এইদিকে, এই দিকটার পেছনটার দিক দিয়ে দেখ। দেখেছিস? হ্যাঁ। এটা তাহলে কি হলো? pterygomaxillary fissure-এর পেছনের দিকে। এইটা নাকি? এটাই তো। আর কোথায় আর আছে কি কোথাও? এটা কোনটা? এই যেটা তো foramen ovale। হ্যাঁ, এটার সামনে একটাই তো আছে। This is foramen rotundum. Okay? इसमें से क्या आ जाते हैं? maxillary vein, emissary nerve, emissary vein. Okay? Now, these two you don't need to know. I have told you about the spine of sphenoid. Okay? जहाँ पे this posterolateral and posteromedial border join, they form the spine of sphenoid. Okay? Now, spine of sphenoid is this one. It is having relations. Okay? Lateral and medial relation. On its lateral aspect, it is auriculotemporal nerve, something related to the ear. Okay? Ear, this one. Okay? So, auriculotemporal nerve. On its medial aspect, chorda tympani and auditory tube. These things you need to know because HOD sir was asked this question during his PG time, so he is remembering this question. Okay? That day he was talking about this thing. Okay? So उनको जो पूछा गया है, there is a probability that this might be asked to you. Okay, if you can tell all the things, then at last he might be asking you the relations of spine of sphenoid. Just जान लो, लिख लो. and it is there in the book also. So spine of sphenoid, lateral and medial relation, auriculotemporal nerve, chorda tympani and auditory tube. Now when you come close, I will tell you about the sulcus tube. Okay, I am skipping this part for now. Now about the temporal part. Okay, temporal part is this bone. Okay, this bone, temporal bone, the whole thing. This part, I am talking about this part. So this is the called the petrous part of temporal bone. This is the squamous. Okay, and there is the tympanic part. Now this petrous part is kind of triangular. It is kind of triangular. Okay, with the apex facing forward. Okay, so this is a triangular thing. Okay, अंदर से देखने में you will see. I will show you, don't worry. On its apex there is this foramen. It is related to this foramen, that is called Foramen Lacerum. Okay, its margin are lacerated, so this thing is called Foramen Lacerum. Okay, not of much importance, Foramen Lacerum, this one. Okay, write it down, what are the things passing through this Foramen Lacerum. So if this is the petrous part, on its anterior aspect, this one is the Foramen Lacerum. ঠিক আছে, সামনে যখন আসবি দেখিয়ে দিস, ঠিক আছে? And the last one, okay? Okay, the last. See this one. This is the petrous part. On its anterior aspect is the Foramen Lacerum. On its posterior aspect is this foramen. Okay, that is called carotid canal. Okay, on its anterior aspect is this one, Foramen Lacerum. On its posterior aspect, on the petrous part only, there is this foramen, that is the carotid canal. Okay, and write down the things that are coming out through this carotid canal. External carotid artery, vein, incisive vein. These are the parts on the middle part of Norma Basalis. Now first 15 come forward.